Good morning, everyone. Welcome to the first video of the day, which will be talking about safe sleep and in particular bedding. So I just will share my screen with you so we can begin. Okay, so I have created a little PowerPoint here on safe sleep bedding. So we're going to start first and talk about cots. So in your service, if you do have children that do sleep in cots, you need to make sure that the baby or child is always placed at the bottom of the cot with no pillows or blankets strictly on or around them. So the mattress that comes with the cot should be the only one that you're using. So please do not add any extra mattresses or padding or anything to the cot. And please do not add any fabric or bumpers to the cot as well. So as you will see the visual on the screen, it shows exactly how a child should be placed in a cot to create a safe sleeping environment when the child is in your care. So also with cots, no toys or comforters are to be placed in the cot. The cot is not to be placed next to any cords, blinds, or wires. The mattress must always be flat. So please do not tilt the cot, even if the parent has requested that, for example, if a child has reflux and they've come and said to you, I would like you to tilt the cot, it strictly must be placed flat. And the cot needs to obviously meet Australian standards. So this is a photo. As you can see, there is a tick next to the image that is showing you that that is the correct cot and the correct mattress. The mattress is flat and there is nothing obviously around the mattress. So in this particular instance, obviously the bow would just be taken off that child's head when that child does go to sleep, but I'm purely just showing you this image for the mattress purpose. So these are examples of bassinets, which are strictly not allowed in your service at all. One thing that also I would like to discuss today is baby rockers. So babies are not to be put to sleep in a baby rocker. If a parent has requested this, the child must be moved to the cot as soon as the child falls asleep. So I have had this instance come about where the parent at home allows the baby to fall asleep in the rocker and has requested that the educator do this. So in this particular instance, the baby can fall asleep initially in the rocker, but as soon as the child is asleep, you are to move them to the cot. Okay, so let's just chat quickly about parent requests. So with children's sleep, in particular bedding and creating that safe sleep environment, you will sometimes have parents come to you with certain requests. Like, for example, I had mentioned before, a child might have reflux and they might say, look, at home, we tilt the cot. Can you also do the same? Or can you allow the child to fall asleep in a baby rocker? Or can you use a bassinet in the service because this is what I use at home? So anything that goes against red nose guidelines and regulations is not allowed. So if you're finding that a parent is continuously coming to you with these requests, which you know you are not allowed to do in your service, please then advise them to speak to the office, and then someone in the office can have a chat to the parents in regards to those requests. Okay, so we're now going to move on to child beds. So majority of the educators that do have children that sleep in their service, the children are on child beds. So just to chat a little bit about the do's and don'ts about this. So each child should have their own bed. There is to be no bed sharing at all in the service, and each child is to have their own set of sheets. So the beds should be spaced apart so the educator can freely walk between the beds, and no pillows are to be used at all on toddler beds. So as you can see, I've put an image here. I've put two images, one that has a pillow and just a throw over blanket, which that's not what we want to see in the service. And then on the right hand side, you can see that the child is on their own bed. They have sheets and there's no like clothing or anything that would be obstructing their breathing at that time. Okay, so that concludes our short video on safe sleep on bedding, and then we soon will start the next video, which will discuss clothing. Thank you.